Just another project coming from the Centre for E-Integrated Care here in the school. This is slightly different. It's looking at using technology to support older adults to live independently at home. So this is a study that's just finished in the last couple of weeks, so everything is very new, and we're still analysing a lot of the data, so it's just going to present a couple of the results, particularly about the acceptability of the system with older adults. So that's the focus of the talk today. As Colette kind of referred to earlier, we're living in an ageing population. I think the current stats are that 15% of our overall population are age 65 and older, and by the time we get to in the 2050s, which is when I'll be looking to cash in on my large public sector pension, those stats are predicted to double, so we'll be looking at 30% of our population being over the age of 65. So, you know, we're living longer, which is obviously great, but we're living longer with chronic disease, we're living longer with frailty. So we really need to think of ways in how we're going to support people, you know, to age well, and also how we're going to support people within the community as well. Because a lot of the research is saying, you know, a recent survey saying that 95% of older adults interviewed want to age in place, want to remain at home for as long as possible. So we need to think about how we can do that. This is very much in line with the HSE mantra of stay left, shift left, which is based on Moore's law for healthcare, and you know, it's very much looking at if you're at home, you know, to stay in the home for as long as possible, but if you are in any acute or kind of primary care, that you are trying to shift left and back into the community for as much as possible. Reasons for that, obviously, most importantly for the patient is, you know, improved quality of life. We know that people want to remain at home and in the community, but also you can expect there's a huge economic benefit to that as well. So with all this in mind, I suppose the focus of the NEX project was really to use different types of Internet of Things technology, and these are technologies that connect over the internet, to develop a technological solution using machine learning and artificial intelligence that will enable older adults to remain living independently at home for as long as possible, and also provide support to caregivers to be able to provide care for their family members or for patients in a non-intrusive manner. And that non-intrusive is really important as well, you know, that very much patient-centred, and that everybody's feeling comfortable with what's in place. And as I said, the focus of this talk, although we, you know, looked at various research questions within the project overall, is really trying to understand the acceptability and the utility of the NEX system by the end users, which in this case was older adults. It's one of our key objectives of the overall study. And just to say that this study was funded by Enterprise Ireland under the DTIF, the Disruptive Technology Innovation Fund. It was a large €3 million funded project, and it was, you know, collaborating with academic partners, mainly from DCU, the Centre for E-Integrated Care being the lead, but we also collaborated with School of Psychology here, with Insight, and then we collaborated with the industry partners who provided the technology and the user interface as well. So as part of the project and an initiative that was very kindly funded by the faculty and by the school, we developed a short video which hopefully works now, which describes the project in a little bit more detail and what we were trying to do. Hopefully it works.
We developed at DCU with industry partners Dabra and Donato as a technology-based system for supporting older adults so that they can live independently in their own homes for as long as possible. To help us ensure that the NEX system can accomplish this, we've worked with older adults, caregivers, and healthcare professionals to help us identify the needs of older adults living at home. Our system consists of different technologies that will work together to support older adults and their caregivers. A voice assistant can help with various day-to-day tasks, for example, reminding you to take your medication. You can command it by speaking, and the assistant will carry out the commands. Sensors can detect activities and environmental information in your home. Information from these sensors creates a picture of your activity and life within your home over short or longer periods of time. Wearable devices collect information on physical activity in sleep and provide feedback to the wearer. Some wearable devices can link with sensors in your home to identify the actions of different people that live there. The NEX system has the potential to enable older adults to remain living independently at home for longer and to facilitate caregiving support in a non-intrusive manner. If you're interested in participating in NEX system trials or would like to find out more, contact NEX at dcu.ie or call 089 265 3954.
So that's just kind of giving an overview of the different types of technology and how we were applying them. So the project itself was split across 3 research phases. The first, as you might imagine, was very much focused on trying to establish the user needs and requirements. So what exactly older adults and other key stakeholders, so caregivers, healthcare professionals, what they kind of thought was important in terms of the needs, their needs, and how we could use technology to address these. We started off these research efforts, they were very much face-to-face interview kind of persona scenario type research style settings, but then COVID happened. I think we had two focus groups under our belt at that stage, so we had to move to an online kind of questionnaire type scenario in the first instance, and then we moved to kind of online focus groups in Zoom, and we provided training to all our participants for that as well. So we collected data from over 400 various different stakeholders. The key kind of themes that were coming out in terms of what was important for the older adult perspective was that the technology could provide emergency response, it could assist with security and also with communication as well. So they were kind of the key areas where they wanted technology to help. This very much helped us inform the design of the NEX system. Then in the next trial phase, we, I suppose, took those recommendations, those kind of needs, and we tried to develop the first prototype of NEX. And merge these technologies together to provide that support. Again, this is in the middle of lockdown, and we're dealing with a very vulnerable kind of population. So the initial plan was to have a technician to go in there and install this technology, but actually our participants, in a very small number, there was 7 just for this kind of pilot trial, they actually self-installed the systems, the technology around their homes themselves. So this was a great achievement and a great undertaking by them as well. So this was in place for 10 weeks. And from a research perspective, we were interested in looking at the technical performance and the acceptability of the system. And as you might imagine, there was a long list of refinements for the final version that came out of that testing. So the last trial was a much larger trial where we deployed what we call the final or the current final NEX prototype in the homes of 26 older adults and across 4 demonstrator sites as well. So one of the demonstrator sites is actually here on the first floor in the community flat. We have mocked the NEX system in that environment as well for testing. So this was for a minimum of 10 weeks. This time it was installed by a technician, which alleviated a lot of the difficulties. And again, we looked at the technical performance and the acceptability, and I'm going to present a couple of the results from this. Just to give you an overview of the different types of technologies, I know some of them were mentioned in the short animation, but we had smartwatches to collect things like sleep and steps. And the voice activated assistant, participants use that kind of mainly for communication, to set reminders, medication adherence, things like that. These kind of technology might be hard to see there. Things like sensors and motion sensors and things like that. They helped us collect information about movement around the home, interaction with various presses and appliances in the home as well, which allowed us to look at things like activities of daily living. So things like getting up and going to bed, eating, leaving the home, bathing and dressing as well. So all this information kind of sent centrally through a hub up into the cloud and then into a user interface where the older adults themselves could look at it, they could get kind of feedback on their various activities. From an eating perspective, just to give you an idea of what that looks like, so this is the kind of data that we can see, and Alan Smeaton's team then applied very clever machine learning kind of processes to this to identify patterns of eating occasions. So these are all just interactions with various presses. We did a very detailed kind of home configuration assessment with participants at the start, so that we knew if a certain press has been opened that this is where they keep their porridge or their coffee or whatever. So we can see, that this person here is starting to kind of, interact in the kitchen at around 9 o'clock. So we could kind of pinpoint this around the start of the day, look at various other sensors around the home to validate that. And you can see there's a number of eating events throughout the day, which is reassuring. Where this might be useful is where we're seeing this change or drop off, and this is where intervention might be required. So a very brief kind of overview of the participant journey throughout the trial. We obviously recruited and screened for eligibility, and then we had a number of visits. Only 2 of them were in person. Obviously this was, we'd come out from lockdown and restrictions had eased, but we were still trying to minimise any risk of infection where possible with COVID-19. So we did a lot of the assessments on Zoom. The installation was obviously in person and the removal was in person as well. From a couple of the visits 2, 3 and 5, they were very much focused on collecting what we call ground truth data, where we asked participants kind of to give us an idea of what they did in the previous day, so that we could look at the sensor data to see if it was kind of accurate. So in terms of eating and what time they left the house at and various things like that, so we could kind of get a sense of whether the sensor data was kind of telling us whether it was accurate or not. And then the last, and this is what the results are based on, was an end of trial evaluation interview, where we used some kind of quantitative methods and a qualitative kind of interview style process as well to collect information on the acceptability. Just to give you a very kind of brief overview, this was a very kind of high functioning population group that we were looking at, mainly female, mid-70s on average, and all have kind of relatively high level of education, mostly able to complete all the activities of daily living, and very familiar with technology, obviously 100% having access to use of smartphone. So some of the results, just very quickly, when we talk about satisfaction, we asked participants to rate their overall satisfaction of using NEX over the kind of minimum of 10 weeks. Some used it for longer. And 90% of our participants were either very satisfied or satisfied with NEX, which was very reassuring. Some of the comments there you can see are the quotes about the sensors, which we were obviously unsure. There's a kind of bit of confliction in the literature about how people feel about sensors and cameras and things about this. These were obviously just sensors, no cameras there. But you can see this quote saying, "I'm happy about them, they don't impact on my life or anything. I'm not uncomfortable or anything because I think it's just going to be a good thing and that's fine by me. I don't worry about them, I just forget they're there and that's the way that I do it." And then talking about Alexa, I used to say thank you and she would say you are welcome. This kind of gave me a warm feeling, which is nice. It's actually good that if you do say thank you to her, she'll respond. Sometimes say thank you. Anytime she will say it's like talking to somebody sometimes. So they were really kind of nice quotes on how people liked the system and the various parts of the system. In terms of the usability, we used a method called the System Usability Score. This is by Brooke et al. And we asked various kinds of questions about how participants found the usability of the system. So you can see our result there is in the middle. It's a mean score of 61. A score of 68 is kind of average acceptability. Anything below 50 is termed, not acceptable. So I would say maybe marginal acceptability. Reasons for this include that some of the sensors, the adhesive that was used on the sensors, they fell off and participants had to replace them or contact us to replace them. There was a manual syncing of the watch data that had to happen every week, and participants found this a little bit burdensome, and there was some issues with the tablet as well. But I suppose these are all issues that can be dealt with, but they were really important in terms of learning for usability. A really interesting thing was about the utility of NEX. I suppose from our perspective we thought that we could see huge potential, but in terms of what the participants thought themselves. So although the ambient monitoring of participants was deemed or well tolerated, the value of the data was not being viewed as overly useful to participants at this stage in their lives. So they could see the potential for monitoring, but often described this as being useful for not now but in the future. So I suppose a key challenge going forward is trying to communicate the need for early adoption of these types of technologies, while people are kind of healthy and able to learn how to use them and interact with them, and further down the line, with any kind of cognitive impairment, things like consent to having systems like this installed and been used, and who has access to the data, become very key issues. So that early adoption is really key. improving the functionality of the system in terms of the direct benefits to the end user. So they really like things where they could see sleep and step data and stuff like that. So those were key features. We need to, I suppose, include more of them in future versions, including health metrics and blood pressure and stuff may incentivize early adoption as well. And this will ensure that the key objective data that the system can provide in order to support and maintain end users to live at home is in place and ready when people need it most. So in summary, although there were some issues relating to the technology, we have a framework that now exists for unobtrusive collection of health and behavioural data, which can be used in the future to make timely adjustments for health behaviour for an older adult population. One of the key innovative features that came out of this was the machine learning algorithms for the identification of activities of daily living from a number of sensors around the home. A key challenge for us, as I said, going forward is to develop a system that's, regardless of age or level of frailty, is adopted early rather than leaving it too late where there might be issues in consent or using it then. And just to say that we are, kind of analysing all the other findings from the results at the moment, but we're currently exploring, I suppose, further funding for this and applications in other areas as well. So things like rehabilitation for different kind of disease cohorts as well, they could have applications here. So just to say thank you very much, and there's loads of information about the project on the website as well.